Hello everyone. In the last video, we have studied about the introduction of gynecology or history collection of gynecological cases. In the today's video, we are going to study about the gynecological examination. The components of gynecological examination are general examination or physical examination, breast examination, abdominal examination, or vaginal examination. In the vaginal examination, we have inspection of vulva or vagina, speculum examination, pap smear or bimanual examination. Now we are going to study one by one in details. The first one is general examination. In the general examination, what we are going to see? We are going to observe the general appearance of the patient, like it is nourished or malnourished or healthy. Okay, then you have to go to state of nutrition, gait of the patient, and demeanor, level of consciousness and responsiveness. Then you are going to check the height, weight, BMI. Then hand, arm, like head to toe examination you are going to do like other patient what you will do. Okay, but here you have to go for extra things, okay, because it's a gynecological cases. But normally head to toe physical examination how we will do for other patient, for this patient also we are going to do the same things. Next is breast examination. So the position patient reclining at 45 degree with the arm at the sides. Means we have to place the patient with the reclining at 45 degree with the arms at the sides. Then in the inspection, you are going to see the position at rest, arms above the head on hips, development of any symmetry of the breast and nipples, reddening of the skin, ulceration or dimpling, okay, retraction of nipple and nipple discharge. Okay, that you are going to inspect. Inspect means just you are inspecting the area. Okay, next one is palpation. In the palpation, you have to palpate the symmetrically for the lump with the flat part of the finger through all four quadrants. If present, describe the characteristics of the lump. Like if there is any lump, you are going to see the location of the lump, size, shape, surface, edge, consistency and the mobility in relation to the deep and superficial structure. Next, you are going to palpate the axilla for the lymph nodes and describe if it is present. Next one is abdominal examination. In the inspection, you are going to abdominal, like if there is any abdominal distension, shape of the abdomen, asymmetry, mass, scar, hernia or dilated veins. In this palpation, you are going to superficial palpation for the tenderness, rigidity and the gardening, and the deep palpation for organomegaly like liver, spleen, kidney, or deep palpation for any mass, and if present, determine if arising from the pelvis. Okay, and percussion means we are going to see that any fluid collection is there not, and auscultation means bowel sound. So these are the things we are going to do in the abdominal examination. First one is inspection, just you are going to visualize the part from the outside. Next is palpation, means you are going to palpate for any mass or any organomegaly. Next one is percussion. In the percussion, you are going to examine for any fluid collection. The auscultation, you are going to see the bowel movement. Next one is see inspecting the vulva. If you see the picture in the vulva, they are going to inspect means visualization. Speculum. Speculum, see there is two speculum. This one is sim speculum or called as single bulb, or this is called as cuscus speculum or bivalve. See, this is the instrument which is used for the examination of the vagina. Means to inspect the internal part of the vagina with the help of this speculum, you can visualize it properly and clearly. So this is called as speculum, and there are two categories. One is sim speculum, one is cuscus speculum. Next one is pap smear. So this is a method by which scraping of the superficial cell from the external os and the lower endocervix are taken by means of special spatula or situ brush on a glass slide and are fixed with 95% ethyl alcohol and air dried. And this preparation is then stained with the papillocolor stain and then examined under microscope. Actually, what happens, cervical cancer nowadays is a very common in women after the breast cancer. breast cancer is the first one, and cervical cancer is the second one in the woman, which is very common nowadays. So after the age of 30, all the women, they should go for this scanning, pap smear. In that they can find out that if the woman is having cervical cancer. So if it is diagnosed earlier, the treatment is possible. So if they, like every 5 years once, they have to go for this scan, pap smear scan. Okay, in that they are going to collect the smear from the cervix with the help of spatula, and they are going to do the test to find out that if there is any like detection of the cervical cancer. Next, see how to take the pap smear. These are the articles needed. Okay, this is spatula, gloves, okay, cuscus speculum, blade, okay, and with this you can see this picture with the position of the lithotomy from the cervix with the help of cuscus speculum. Through the spatula they are going to collect the smear and send it for the cervical cancer test, or which is called as pap test. And this is how to take herpes virus simplex, HBS. For this also, how to collect the this smear, okay, or sample. Next is bimanual examination. See, vaginal examination only we have done in so many categories. I have told you about the speculum examination. With the help of speculum we are going to inspect the vagina, but in the bimanual means through hand. Okay, by inserting the finger they are going to examine the vagina. You can see in this picture. Okay, one hand above the abdomen and one hand through the two finger they'll insert into the vagina to examine the any abnormality. That's why it is called as bimanual examination.